right, welcome everyone. My name is Hannah Hogue, and I'm a program manager at the Alliance for a Healthier South Carolina.
And I'm Landon Campbell, also a program manager at the Alliance for a Healthier South Carolina.
We will be your contacts at the Alliance for assistance and questions related to your scorecards. We have put together some training videos that outline the specific usability of scorecards within the Alliance instance. Let's start by discussing what Clear Impact Scorecard really is. Clear Impact Scorecard is a performance management system used by public health, healthcare, nonprofit, and community coalitions to track progress, align partners, and improve outcomes, all using the results-based accountability framework. In plain terms, what the scorecard does is turns plans into actions. You can map your big picture goals and create strategies that are measurable and actionable. Track what matters. So as you will learn, as you understand the results-based accountability framework, Clear Impact Scorecard distinguishes between population level results and performance measures. So really allowing you to differentiate what your community as a whole is working on, and then how your specific implemented strategies are impacting your overall goals. It keeps everyone aligned, so multiple organizations can work towards shared goals using the same language, measures, and data. So again, for those of you who are in the coalition setting, really creating that one central place for all of your measures and your coalition work to be tracked. And then it finally supports learning and course correction. So if you're using the scorecard to publicly display what you're doing and how you're doing it, and you're really using those performance measures to drive change, you will see when something is not working, when you need to change it, when you need to course correct, and when you need to bolster and spread a proven strategy even more. So as we think through scorecard, I do want to make this caveat. When you will pull all the data that you enter into scorecard. So whether it be indicators or performance measures, those will all be data that you collect from, your indicators will be data that you collect from potentially the Department of Public Health, the CDC, county health rankings and roadmaps, kind of that state level, county level data as a whole. And then your performance measures will be any data that you are gathering yourself. So your scorecard will really only be as good as the data you find and collect and then enter into your scorecard. The terms you'll hear a lot about as we talk about your scorecard are going to be results, which are the long-term conditions you want for the population. Example shown on the screen here, all residents in Lexington County have access to nutritious and affordable foods. Indicators, which are data points that show whether the population result is improving, often from public data sources. So that's going to be that data that you find through the DPH dashboards, which are SE Health Compass, or through CDC, the census data that's collected at the state level. Then you will also have strategies or programs. You'll see both of those available as a container, and those are going to be what partners are doing to influence the result. So those are going to be the specific programs and or strategies you or your group and organization are implementing. Then you'll see the performance measures, which will tell you how well those strategies are implemented and answer those three critical questions related to RBA, which are how much are we doing, how well are we doing it, and is anyone better off? And then finally, a term you'll hear a lot about as we move through this process is disaggregation. So that means breaking data out by race, geography, age, etc., to understand equity and disparity. So really taking your population that you are implementing within and just digging down a little deeper and making sure that everyone can be stratified and that you're affecting the population well across different race, genders, ethnicity, whatever it may be. For more information about the RBA framework, so if those terms we've said today aren't super familiar with you, or you just like a better grasp of what RBA is, Please visit the South Carolina AHEC website. On there are some free online modules that are specifically related to the results-based accountability framework and will be super helpful as you begin your journey into inputting your information into a scorecard.
All right, thank you, Hannah. So I'd like to close us out with just one more bit of information today, and that would be how to access your scorecard page. So to get started, you'll need a login that will allow you to access your specific scorecard page, and I will be your primary point of contact for this step. Once we understand which scorecard page you'll be responsible for, I will set up your initial account and you will receive an email allowing you to log in with a temporary password. So from there, you'll be able to set up your account, get a permanent password, and then also see the scorecard page where you'll be putting your data. Now, if you have any issues with and/or questions about your scorecard, just reach out to Hannah or I, and we'll be able to assist. Clear Impact also has a help center where you'll be able to find a variety of resources and tutorials to assist you along your scorecard journey. And then the next several videos within this series will also help you to troubleshoot each part of your scorecard experience. Thank you all for your time today.